Have you ever felt like the healthcare industry, what I will call the medical industrial complex, is more of a corrupt monopoly owned by the pharmaceutical industries and almost run mafia style to push drugs and medications as the only approved outcomes in medicine? If you've ever felt that way, first of all, you're not crazy. We're going to go through a report today called the Flexner Report that's over 100 years old that shows not only is that the reality, but this was the intention for medicine all along. Now look, as we go through this, I want you to understand I am not attacking your doctor, your nurses, or other healthcare professionals and practitioners. These people are good people. They want to help you. They're likely doing their best for you. But what I want to bring to light is the corruption of the medical system itself, which is not designed to get you well, but just more so designed to push more drugs and medications that suppress your symptoms, but never return you to your full level of vitality. So we're going to talk about a report called the Flexner Report. This was published in 1910. It was a landmark medical study. It was a landmark study of medical education in the United States and Canada that fundamentally reshaped the landscape and has had far-reaching implications still felt today. So this essentially was commissioned by, if we go back to most anything today, even in our modern life, the healthcare industry, the banking industry, most manufacturing and other aspects of big industries, there was a small group of powerful men in the late 1800s and early 1900s, like the Rockefellers, Carnegies, Rothschilds, JP Morgan, and others, that controlled almost everything in the world back then. And although they're dead, their institutions, their thought process, they still control much of what we experience in reality today. So Carnegie and the Rockefeller Foundation got together and said, we want to go over and audit all the medical schools in the US and Canada and come up with standardized procedures for testing, for accreditation, and for how to practice. That sounds on the surface altruistic and a good idea. In fact, as we read through this, ChatGPT kind of frames it somewhat that way. But as we're going to really see, this was a monopolized takeover of medicine to get rid of any dissenting thoughts, anything that's natural based like naturopathy, homeopathy, chiropractic, nutrition, supplementation, and bring it all under the umbrella of allopathic medicine and what today is known as science-based medicine. And all that, again, sounds altruistic and good, but really science-based medicine means that the pharmaceutical industries that have the financial interest to push certain narratives through are the only approved forms of thought for doctors that want to practice medicine today. All right, so what were some of the key findings? There was initially 155 medical schools. Abraham Flexner, which was an educator, not a doctor, who was the one who carried out this report, he visited these schools. He harshly criticized most of them. And some of his major recommendations included, as we mentioned here, some things that sound altruistic. Have a college degree before going to medical school, that's fine. 2 years of basic science training, followed by 2 years of clinical practice, and affiliation of medical schools with teaching hospitals, and essentially shutting down any proprietary medical schools. Meaning if you don't follow this train of thought here, you're not going to be accredited, you're not going to be licensed, you're actually going to be vilified, shut down, attacked, and it completely changed the landscape of medicine for now the next 115 years. So what did this lead to? It led to the closure of over half of all medical schools. Especially hard hit were black medical schools and women's medical colleges. Look, if you even think to the 40s, 50s, 60s, what was it? It was a monopoly of white male medical doctors that fit this certain type narrative. It's gotten better today as far as the influence of other women and minorities and things in medicine. That's changed, but the philosophy has not changed, the intentions of this report. There was increased prestige for MDs and marginalization of all alternative healing systems. I won't be going through in future videos just the clandestine attack and the mission by things like the AMA to not just suppress, but to completely shut down and eliminate, contain and eliminate, was their exact words, the profession of chiropractic, nutrition, homeopathy, and naturopathy. Some of these next videos are going to be really good. So what this led to is that medicine became centralized and monopolized under allopathic practice. It eradicated many natural and holistic practices. It increased the influence of pharmaceutical companies, especially those tied to the Rockefeller-funded institutions. We'll go over that in a minute. He had big ties to the petroleum industry. And by bringing medical schools under this pharmaceutical-based, petroleum-based model, where now he controlled, or the Rockefeller Family Foundation controlled, the petroleum industry and the development of synthetic medications, it was just a way to control not only medicine, but to grow their wealth. And it contributed to a profit-driven healthcare system aligned with big industrial interests. You can go through this stuff here, pause it if you want to. What this did, I'll read this real quick. So some critics argue that the Flexner Report was a corporate takeover of medicine disguised as a reform. Absolutely, I guess that's what I'm trying to say here. It was disguised as reforming medicine, but really it was a hidden corporate takeover. It helped to shift healing from community-based, multimodal approach, so different modes of healthcare, into a top-down pharmacocentric model, and created the foundations for what is known today as the medical industrial complex, driven by Rockefeller and Carnegie money. So look, a lot of what is called conspiracy theory today, if you just do a little bit of digging and go back and look at some history, what's conspiracy is in all reality people who are critically thinking and looking at the facts, and that term conspiracy theory was designed to be discrediting. All right, so I asked one more question here. I said explain how the practice of medicine became pharmaceutical based after this time, and what role did the petroleum industry play in this development? How would the petroleum industry play a role in medication? It says after the Flexner Report in 1910, the practice of medicine in the US became increasingly pharmaceutical based. And this shift was not accidental. It was engineered through a combination of educational reform, financial influence, and industrial interest, especially from the petroleum industry. We're going to find out who owned the petroleum industry. So medical schools standardized towards allopathic and a drug-centered medicine model. This is where they shifted to. The Flexner Report advocated for a scientific lab-based model of medicine rooted in physiology, pathology, and pharmacology. We already discussed some of this. I won't be redundant. Alternative medicines were deemed unscientific and excluded from curriculum. And schools that didn't conform to a pharmaceutical-based model, especially those that advocated any natural remedies, were defunded and shut down. However, this funding of the medical schools who now wanted to stay open and keep their accreditation, it came with financial strings attached. The Rockefeller Foundation and the Carnegie Foundation poured massive sums into selecting medical schools like Johns Hopkins, Harvard, and Yale, but only those that adopted the new pharmaceutical aligned model. These institutions became gatekeepers of medicine, education, and research, and it's still that way today. These are some of the most prestigious schools, Harvard, Yale, Johns Hopkins, and they're gatekeepers. And if you want to have that prestige, there's no way of getting in there and being part of that community unless you align with their philosophies. So the role of how petroleum play a role in the pharmaceutical industry. Here's the Rockefeller connection. It says John D. Rockefeller, founder of Standard Oil, a massive oil company at the time, had vast influence over the entire U.S. economy. And in the early 1900s, Rockefeller transitioned from oil to pharmaceuticals. He invested in chemical-based medicine, which were petroleum derivatives to manufacture synthetic drugs. A lot of synthetic drugs today, and definitely at that time, were petroleum-based, synthetically made from petroleum products. Rockefeller's advisors, Frederick T. Gates, helped establish the Rockefeller Institute for Medical Research in 1901, and now Rockefeller University, and it became a powerful force in shaping drug-based medical research. Many early pharmaceuticals were synthesized from coal tar and later from petroleum, and by funding and shaping research institutions, the petroleum industry redirected medicine away from, plants, natural things, herbs, plants, and towards patentable synthetic chemicals. You can't patent plants, you can't patent herbs, but you can patent synthetic chemicals, and when you isolate aspects of these plants and herbs into a medicine, that's what you can patent and then profit off of. So this is a profitable move because natural remedies like herbs and food-based treatments and homeopathy, they can't be patented like I just said, but synthetic drugs derived from petroleum can be patented, creating exclusive for-profit models for pharmaceutical companies. All right, I'm gonna end it here, and some of the stuff I've already mentioned, it will be redundant to keep going on here. I hope this is helpful. I'm gonna be going in future videos looking at the AMA, the American Medical Association's attack at the chiropractic industry, and also Royal Lee, the founder of what we know today as vitamins, the original vitamin pioneer, nutritional pioneer, and how he was attacked by these very same institutions, silenced, sued, shut down, and essentially because he was saying that, hey, plants and herbs and vitamins are a way that we can improve our health, and it went against this pharmaco-based narrative. So I hope this is helpful, understanding just really why our healthcare system is why it is today. In our lives, none of us were alive 115 years ago. It seems rather modern, the takeover of medicine and the push for this only pharmaceutical-based model. But like many things, if you go back further in the history and look at some of the people that were controlling the industries at that time, there was an agenda, there was a narrative, and we are living out that narrative today. So thanks a lot for watching. I'll see you in the next video. Have a great day.